I should introduce myself really, shouldn't I? My name is Jane McMorrow. I am Director of arts charity Creative Future. I'm also co-chair of the Arts, Health and Wellbeing group here in Brighton and Hove. So the AHW group here is an informal group of people working in the arts, health and wellbeing sector. We meet quarterly. The meetings are facilitated by Brighton and Hove City Council, and we are one of 5 groups, each focusing on different areas and different sectors of the city, and working together to deliver a cultural framework for the city. And if you want to find out more about the work of the cultural framework, you can go to our website, cultureinOurcity.com. So please do take a moment to visit that website and look at the work that we're doing. I'm going to start by introducing David Brindley. Hi, David. Hello, David. It's so lovely that you could be here with us this morning. David is Public Health Programme Manager at Brighton and Hove City Council. The co-chair of the Arts, Health and Wellbeing group is Alistair Hill, who is the city's Director for Public Health. Now, as you can imagine, Alistair's been quite busy since March, and we've been really, it's been great that David has been able to sort of step into Alistair's role a little bit, and has been hugely supportive in helping us develop this conference for this week. So I'm really delighted that you could be here, because I know within your role currently is setting up the city's track and trace system, and I think you've been quite busy on that.
Yeah, just a bit. And I have to say, this is the only bit of Alistair's role that I'm happy to step into. I wouldn't want his job, that's for sure. But yeah, we are extremely busy. But you know, we mustn't forget what we're here for, really, which is improving the sort of health and well-being of the population of our city. And this work is every bit as important, and particularly during the current time and when we go into recovery, as anything else we do. And before I came in, I was just thinking about public health work, you know, stopping smoking, you know, losing weight. But the more I'm involved in this work, the more I see how important it is, and how, you know, really it's of equal importance to any of those things for our health and well-being.
So anyway, we are going to move on, as you said, to introduce our panelists. Each of them are going to talk for about 5 minutes on the incredible work that they're all doing, and then we will bring them back together, and David is going to just oversee the questions, and we hope that will be a really useful and discussion. So the first up is Dr. Aristeia Fotopoulou, and Aristeia is a UK Research and Innovation Fellow and Arts and Humanities Research Council Leadership Fellow, whose research focuses on social transformations that relate to digital media and data-driven technologies. Aristeia has published widely on critical issues of digital and emerging technologies from a feminist perspective. She is Principal Lecturer in Media and Communications in the School of Media at the University of Brighton, and postgraduate research coordinator of the School of Media. Aristeia, it's fantastic that you could be with us this morning. Welcome.
Thank you, Jane, and thank you for the invitation. I'm really glad to be here, and I really look forward to our discussion. Thank you for introducing my role so succinctly. I'm going to speak to you a little bit about the Art Data Health project that I lead currently at the University of Brighton. So this is a project that comes from an understanding and a question that we had about how we can bring together the development of digital skills with creativity, especially because there is lots of research that shows that people who have difficulty accessing health information may be also digitally excluded, and at the same time they may be part of groups that don't really have much access to the arts. So these kinds of inequalities overlap. So the project tried to address this issue of these overlapping inequalities, health inequalities, and other inequalities by bringing people together in workshops and co-producing artwork. And the key focus of the project is health and well-being data. This sounds a little bit perhaps confusing, but we are nowadays, we are more and more accustomed to the ways that our data are being collected by GPs, but also we ourselves, we collect data, for example, when we go running, or when we use a Fitbit or such a device, a digital device, or just our mobile phone. But we don't really see what happens to this data, and we don't really realize that these data are being used by third parties, they're being sold, somebody makes profit from this data. And we may see these data, especially during COVID. We've seen lots of visualizations of COVID data, but we may not necessarily have the skills to understand how the data are being interpreted. And there may be that there are voices that are not being heard in these stories and these narratives. So this is what the project tried to do, try to reach out and tell people's stories and understand their experiences and their emotions. So as an academic research, what we tried to do was to build a bridge between creativity and the development of data skills and digital skills. And we've tried to do this by organizing workshops. We organized workshops with lots of community organizations. We've been having, the project goes on to May, really, next year. We've had a very interesting partnership with RISE. I'm going to talk about it in a minute. But lots of other organizations. We had a partnership with Wellbeing, and we had participants in our workshops where we tried to look at the skills that people need, and especially staff from community organizations, in order to look back at the data that they collect from service users and see how they can use this data, how they can visualize the data or tell data stories that they could then use for their funding applications and for public communication, communication with a wider public. So these are some photos of things that we've done before lockdown, when we could actually use arts and crafts materials. We've also done a symposium and an event at the Brighton Digital Festival. So one of the key things that has been produced is a data skills toolkit, which is available online from the artdatahealth.org project website. I'm going to post the link later on the chat. And this is this data skills toolkit is a collection of exercises, very simple exercises that any organization can download and they can do themselves with their staff. Now, one of the key outputs of the project has been Anna Dimitri's sculptural installation called Shielding. Because when lockdown happened, we realized that we had to change the focus of the project. We had already a partnership with RISE, and Anna was going to work with domestic abuse data to co-produce artwork with staff from RISE. But this couldn't really happen, so Anna started focusing particularly on the data of the rise and the rise of domestic abuse cases during lockdown. And she's done a fantastic installation. We did a video of the launch of the installation. Again, there is a link which I'm again going to post later in the chat as well. But she also produced a little art kit that we sent by email to staff from RISE, where they could create a room of one's own. And she played with this idea from Virginia Woolf's story and also essay that women need a space, their own personal space, and a room of one's own in order to flourish, to be creative, to write. and we asked people to imagine what that could mean for them during lockdown, and they had an opportunity to draw. You can see the picture there, and to imagine what that could be for them. Another key output from the project is the lockdown data story 104 days later. And I'm going to show you this on the website. So this is something called a scrollable online website. So if you visit this, you will see, and you start scrolling down, you will see lots of data, statistical data that we got from the Office of National Statistics, that we combined with testimonies that we got from local residents in Brighton and Hove. So we did a survey, we invited people to respond to the survey, and then we followed up with video, audio interviews. And these are looking at the impact of the lockdown on some key categories, such as physical health, mental health, impact on work and life balance. And as you scroll down, you will see how we've used the testimonies, so the personal stories, the personal experiences, but then we have kind of matched this with the official data, the official statistical data. So it goes beyond a plain data visualization to consider the hidden stories behind the lockdown. It will take you quite a while, and I'm not going to scroll all the way down, but I've collaborated with a data designer, Caroline Bevon, and she's done an excellent work. We're working with Caroline further, and also with the immersive theatre company Hydrocracker, because what we realized from this particular survey was that we, again, because of issues with digital inclusion, and because people who are really marginalized weren't really able to provide these kinds of testimonies. So there was an issue for us about reaching out and reaching people who are difficult to reach. So I worked with Hydrocracker, who managed to actually, within the measures of social distancing, they managed to actually get to the people and get their testimonies, their videos from communities, specifically around Whitehawk. They visited food banks. They went and met people from vulnerable communities. So we are doing a film now. The next step is a research film, which is going to be combining these live shots with animation infographics. So we have how people are looking at the future now, instead of reflecting on the lockdown, but actually a more positive stance and a more kind of positive message about what comes next, and how people hope that the lockdown will change the way that we live now. So we are preparing this film. I am directing the film, and like I said, it's going to be a combination of the live testimonies with the infographics. Again, trying to understand how we can approach this health and well-being data that are not just for professionals or for those highly trained in understanding this data, but how we can democratize this health and well-being data, and how we can bring the experiential stories to the fore.
Next, I'm going to introduce James Sanderson. James is Director of Personalised Care at NHS England, and is also Chief Executive of the National Academy for Social Prescribing. James works within the Strategy and Innovation Directorate to oversee the strategy and delivery for a range of programmes that are helping to empower people to have greater choice and control over their care. This includes the Personal Health Budgets Programme, Social Prescribing, Shared Decision Making, Personalised Care and Support Planning, Maternity Pioneers, and developing and implementing new models of delivering patient choice. James, it's so great to have you here with us today. Thank you so much for finding time to be here. We really appreciate it, and welcome.
Thank you very much, Jane, and good morning to everybody. So I just wanted to outline what's happening nationally within the NHS and within the National Academy for Social Prescribing that supports the work that you're all doing, and the challenge around how do we develop a common language across arts and culture and health is something that I think we can meet very, very easily. Just to start off by saying, you know, this is talking about more culture, less medicine, but medicine's still great. We still love drugs. Obviously, at the moment, as we face the challenges of COVID-19 pandemic, the nation is focused on the pursuit of vaccines so that we can return to an element of normality. But we know that what goes on in hospitals and GP practices doesn't define how healthy we are, doesn't define our well-being. It provides a massive contribution, but what makes us well goes on in our daily lives. And we're starting within the NHS to look at ways in which we can rethink medicine, ways in which we can reach people in different ways. If you think about the revolution around medicine, the biggest public health advancement is really running water and sanitation. That's sort of the first revolution. And then in health, we've had a second revolution, which is the movement of modern medicines, including vaccination and including surgical procedures that we've seen over the last century or so. But actually, we're starting to realise the limitations of this. We're starting to realise that there are social solutions that can be just as effective. We're also seeing challenges in general practice on a day-to-day basis. The hard evidence shows that at least 1 in 5 GP appointments are taken up by somebody that has a non-medical need. It's an issue of relationships or social isolation or loneliness or debt or housing. And actually, most GPs that I speak to on a daily basis say that it's generally upwards of 40%, 50% of their appointments that are purely related to social needs. Alongside this, whilst we've got a lot of people seeking support from the NHS, but with a social, not a medical need, we've got a lot of medical conditions that we know would benefit from a social solution alongside a traditional medical pathway. And that's where personalised care comes in. Personalised care means very simply giving people choice and control over the way their care is planned and delivered, based on what matters to them and building on the assets that they bring to their own care, because we're all experts in our own selves. And what we have achieved over the last couple of years is the beginning of a massive culture shift within the NHS. In 2019, within the long-term plan for the NHS, we made personalised care one of the 5 key shifts for the future of the NHS in this country. And linked to that, social prescribing was implemented as part of our comprehensive model for personalised care. So the things that Jane set out, shared decision-making, choice, personal health budgets, supported self-management, social prescribing is part of what we call our comprehensive model. It is really the transformation model of how we deliver personalised care universally across the NHS. And we've been growing social prescribing as a huge movement in the NHS. And in July last year, we put social prescribing as a critical part of the GP contract. Now, this may sound a bit bureaucratic, but actually the GP contract is one of the biggest contracts this country has in terms of monetary value and scope. And now, within primary care networks across the country, general practice has to deliver a social prescribing service to its community that it's supporting. And we're investing massively in this mechanism. Through £450 million worth of investment, we're putting in an infrastructure of 4,500 link workers whose job it will be to connect people to community initiatives like culture and the arts, or exercise and fitness, or activities in the natural environment, or advice, guidance, support that individuals need to live healthy lives. And this is a big shift. We're the first health economy in the world to create the opportunity for psychosocial support, for community support, to be there alongside biomedicine within a medical structure. So social prescribing is incredibly exciting. We've already got 1,300 link workers in place, so the numbers are building very, very quickly. And this time last year, Secretary of State asked me to also establish a independent organisation that was going to help champion the arts and culture and sport and exercise and the natural environment outside of the NHS. And that's where the National Academy for Social Prescribing comes in. So the National Academy for Social Prescribing has a role to make noise about social prescribing, to support funding structures and resources for the voluntary and community social enterprise and faith sectors. And we launched last week our Thriving Communities programme, which is starting to forge collaborations at local areas across our 7 hubs across the country. We're also looking at the evidence base for culture and the arts, supporting people to live healthy lives. And we are working on the development of a global alliance, because lots of countries across the world are now looking at the fantastic work that's coming out of the UK. So we've got a huge agenda, I think, that is a shared narrative. Social prescribing creates that dialogue that I think links culture and the arts much more effectively with health, and links health much more effectively with culture and the arts than it's ever been linked before. I think we've got a common understanding now of what we want to achieve together. I really, really appreciate and admire the work that you all do as artists and practitioners in this field, and the fantastic contribution that that makes to the health and well-being of individuals across the country. And we just want more of this. This is a fantastic way that we're going to transform lives going forward. And I really do think that embracing culture and the arts is part of the bedrock of how we maintain health and well-being in a new modern healthcare system. Thank you.
Thank you so much, James. It was fantastic to hear from your perspective where all the work that our local artists and arts organisations are delivering. So it's really, really reassuring to hear that those, in terms of moving forward, where we are being positioned. So that's fantastic to hear. I should also say that more culture, less medicine is absolutely not saying that we don't love medicine. We think it's fantastic too. But I think there is quite a lot of evidence around over prescribing, perhaps, of certainly with opioids. And I think that we want to see, as you very clearly outlined, that very often people are perhaps prescribed a drug when actually another intervention would be much more beneficial. Thank you so much for your perspective on things. We'll be coming back to you a little bit later. Next panelist, who is Polly Irvin. I hope, Polly, that you're okay to come in a little bit earlier. Polly is an interactive arts psychotherapist, clinical supervisor, tutor and theatre director, and she is therapy services manager at RISE UK, which is the domestic abuse charity. Polly manages the RISE therapy service, which is a trauma-informed service for women, children and young people impacted by domestic abuse in Brighton and Hove. She is the lead therapist in the service, offering one-to-one interactive arts psychotherapy, as well as running a wellbeing group, which is a trauma stabilisation group. She is also a trainer for the Therapeutic Wellbeing Practitioner training at the Institute for Arts in Therapy and Education in London. Polly, thank you so much.
Thank you, and thank you so much for inviting me to be on the panel today, and for all the wonderful work that you've all been doing. It's been a fantastic conference and it's great to be here. So I'm going to introduce myself by sharing my screen and just saying a little bit about who I am and why I'm here. So I actually started my working life as an artist, as a theatre director and as an actor. And I was also taught theatre directing at Rose Bruford College. And I then went on trained to be an integrative arts psychotherapist at the Institute for Arts in Therapy and Education. And it was really here that I really recognized and really understood the power, the transformational and healing power of the arts. We got to kind of we were trained to work with lots of different modalities, lots of different ways of working creatively. So the Jungian sand tray, the clay, music, drama, creative writing and storytelling, art, body work, puppetry work. It was the most fabulous experience being on the training. I've gone on to, this was quite a few years back now, and I carried on working in that way in private practice as a psychotherapist. But I'm also now the therapy service manager at RISE. I've been there for about 3 years. And RISE is a domestic violence charity in Brighton and Hove, women, children and people who've been impacted by domestic abuse. And we are a trauma-informed organisation. And really, not just me, but as a team, we've really tried to promote working in a creative and relational way across the whole organisation. The therapy service is funded by the CCG, and we're also in a trauma pathway with NHS Sussex Partnership, their trauma provision, and Survivors Network and Mankind. So we've really been developing a very good collaborative process across the city for working with trauma. We offer one-to-one therapy, group work, and trauma processing therapy, which is called EMDR. And but we integrate the arts and creativity into everything that we do. We also collaborate with lots of arts organizations. This is an example of some of our work, Mother and Child Therapeutic Arts Group. This was where the mothers and children learned to sort of play together and work together. The mothers drew around children here, and together they created the images. These little boxes here, together, mother and children created an image of a safe place. This was a piece of work that was facilitated by a therapeutic arts wellbeing practitioner at our refuge, working with the residents at the refuge. And they put this, there's more to this huge mural. They've put it up in the corridors of the refuge, and one of the children now sort of renamed it the Art Corridor. We use the arts in our trauma stabilization groups. And this is a wonderful project that our Big Lottery Community Project have been working on, going out into the communities to work with Black and minoritized groups, and really finding ways to build conversations and working with them. And you can see they've done this wonderful sewing group and made these great garments here. And this is the Adolescent Girls Group, which is at the Plot in Stammer Park. This is the one that sort of moves me the most, actually. And there's a quote here from a couple of the girls who are in that group. And you can see here, you know, this girl is saying, I've been struggling with school. I find it really stressful and often only go in for half days. I do not have friends there. Unlike school, I really look forward to coming here and being with the people. The plot is away from everything, all the stresses of life. It feels calm here, and I feel calm being here. I enjoy doing the creative activities with the group. And we did ask the girls if they would contribute to this conference today by giving us that quote. So thank you for that. And so I'm really, one of the things we're aware of at RISE, and people have talked about, there is a huge need out there. We've got a massive waiting list, and so have the other organisations in the trauma pathway. Our referrals have tripled during lockdown, and in fact we had another surge last week. there is a mental health crisis going on out there, and we're also having a difficulty reaching communities who might not be accessing any services at all, such as Black and minoritized communities. So what do we do? Well, this is partly sort of in reference to maybe the next questions coming up, but you know, from my perspective, it is about collaboration. Arts organizations, health organizations, charities, service providers really coming together and working together, co-facilitating, co-creating, cross-fertilization of skills and knowledge and resources, training, funding, and also recognizing the research-based and evidence-based approaches, the research that's already out there, and doing more research, developing more research in the future. So running alongside this work, I've been for the last 12 years involved in developing a training at IATE in a new type of practitioner, which we've called the Therapeutic Wellbeing Practitioner. And this training grew up out of charity work. It grew up out of Kids Company in London. And it was really about us trying to work out how to support this community of vulnerable young people and families, how to help them with their mental health and well-being. And what we knew was that we didn't want to medicalize them, we didn't want to criminalize them, and that the therapy room maybe wasn't the right place for them, and that the middle-class white therapists maybe wasn't the right thing for them either. And so what we decided to do was disseminate the knowledge and the skills base from the therapy world out to the workforce that were actually engaging with children, young people and families. And that was the artist, that was the music tech teacher, that was the dinner ladies, the football coach. And so we trained that workforce to be able to work therapeutically in the settings in which they were engaging with vulnerable people. And this is just a little whiff. I haven't got time to go into it really of the course content, but we're looking at all the relevant applied therapeutic theory, being trauma informed, creative and relational communication skills, and how to develop safe and effective practice. Because it's wonderful, artists and arts organizations doing this work, but how do we make sure that we're also understanding how to work with safeguarding, ethical practice, working with diversity and adversity, signposting and referring on, and understanding how to manage boundaries, professional practice, and your own reflective practice. I muted myself, sorry. We've been considering the possibility of developing the therapeutic wellbeing training in Brighton, and we're really keen to sort of talk to anybody who might want to have that conversation with us. And just to finish off, I've got a couple of quotes from two of the students from the course who are both arts practitioners. So this is from Marie Vickers, who at the moment is the interim director at the London Bubble, and she's the project lead, has been for many years, for the Young Theatre Makers programme, and a youth leader at the Bubble Theatre. And she said, the therapeutic wellbeing practice training has equipped me with the theoretical knowledge to underpin my arts practice with vulnerable young people. I'm able to apply elements of the training throughout my work, particularly trauma-informed approaches and emotional regulation. I now have a better understanding of the links between creativity and well-being and the importance of human relationships in young people's development. My capacity for personal reflection has increased, and I have a stronger framework for this. The team are hugely supportive of my work and my individual journey, and the community of students and graduates are inspiring. And finally, Alex Evans, who's the artistic director of Kazoom Arts, is doing wonderful work with refugees and vulnerable communities. And he said the opportunity to train as a therapeutic, Alex is an artist, The opportunity to train as a therapeutic wellbeing practitioner has supported me to deepen my arts practice and encourage new modes of psychological thinking. The multidisciplinary approach of the course has empowered me to develop insights and leadership potential so that I can steward my charity with a more connected, insightful, and community-centered approach. So that's the end of my presentation. And just to finish off by saying, as an arts practitioner and as a therapist, I really am keen to look at the benefits of therapy feeding into arts practice and arts practice feeding into therapy. Thank you.
We're going to move straight on, and the next person I'd like to introduce is Donna Chisholm. Donna is Assistant Director, Culture, Tourism and Sport at Brighton and Hove City Council. She's an experienced senior executive with a very strong track record of leadership in the charitable and private sectors, and is skilled in achieving outcomes through collaboration, strong governance, innovation and change management. Prior to her role here in the city, Donna was area manager for Moray in Highlands and Islands Enterprise, which is the economic and community development agency for the north and west of Scotland. We were really delighted when we managed to lure her down from the north coast of Scotland to the south coast of England, and we're really delighted that she's here with us today to tell us a little bit about her work. Donna, you're very welcome.
As you, within your introduction earlier, said, the council, with many partners in the city, manages and facilitates a cultural framework of which this conference is part, and we're absolutely delighted to be supporting it, and many wonderful things have happened over the past few days that will indeed inspire and direct us for the years to come. But each of the 5 strands within the cultural framework for the city are interconnected, and I think it's that interconnectedness that's so critical and will be critical as we move forward through the pandemic into recovery and beyond. I think from the council's perspective, just to touch on a few things, this conference undoubtedly over the last few days has showcased some of the health and wellbeing projects underpinned by that are funded by our third sector grants programme, and we're absolutely delighted to do this to support arts, health and wellbeing over a 3-year period, as well as more widely across the community and voluntary sector. Within my portfolio in the council, I have a wonderful job, I have to say, because I look after things like seafront access. So I look after the seafront, I look after the way visitors and residents interact with the seafront and the quality of the environment that's quite unique to Brighton and Hove in many ways. The council looks after 13 kilometres of seafront, which is both terrifying and wonderful in equal measure at different times of the year. But it is a resource that residents and visitors really appreciate, and is one where we managed to bring the arts, health and wellbeing together over the course of the year. Another part of my portfolio is sports facilities, and indeed sport, exercise and physical activity are key to wellbeing and to health. And one of the things we're doing at the moment in the City Council is actually consulting on our future investment in sports facilities. That consultation is currently open on the council's website, and sports facilities more widely are so very important within communities, and the access to them is a key part of what we're trying to ensure for the next generation of residents in the city. So do, if you have the opportunity, contribute and feedback on our sports facilities consultation. Aligned to that, of course, the council has a very active healthy lifestyles team who work with sports to ensure that we have a very combined approach to all of our residents leading active and healthy lives. And of course, arts and wellbeing sits very comfortably within that, because access for all of our residents is extremely important. Another part of my portfolio is festivals, because I look after outdoor events, and the council has many outdoor spaces across the city that are used over the course of the year to support around about 60 festivals. And these, most importantly, are sharing opportunities. Just thinking back to what James said in his presentation about the social nature of wellbeing, we recognise that within culture, tourism and sport. And one of the things we do is use the city's facilities, use the city's infrastructure and assets to enable celebrations, festivals, coming together of people, you know, for different reasons. It's very much a sharing city, Brighton and Hove, and this is one of the things that the council really tries to do through facilitating and encouraging access to its assets. I have to say, in 2021 already, we are very focused on recovery and on using spaces, particularly in the second half of the year, to facilitate that sense of belonging and sense of social interaction and the warmth that people get from being together that's been so problematic over the course of this pandemic. Another part of the council's work, of course, is the management of the city itself. And at the moment, we are working on a new city plan. And the reason that's important is because of the way in which the city's environment, the city's public realm, affects how people live, work and enjoy the city. And the city plan part 2, as we call it, will be out over the course of 21-22. Very core to that is the notion of a living city, a green and sustainable place that enables people to live healthy lives, enables people to have access to outdoor space, and is designed to facilitate interaction with neighbours, to facilitate, I suppose, the things that make quality of life extremely important. And as we move through the 21st century, it's really important that we manage and are aware of the massing within cities and the way in which that can become a barrier to health and well-being, as well as a barrier to creative expression. As buildings get bigger, masses get bigger, and people find less space for themselves to mix with others. So that is something that the City Council as a whole is very, very aware of. We're a small city, but a growing city in a very confined space. Another quick thing for me would be to say that another part of my portfolio would be around heritage, and particularly, for example, with Royal Pavilion and museums in the city, how do we use the collections, how do we use the buildings to facilitate social interaction, to facilitate creative exchange, and to fuel, I suppose, creative and artistic imaginations. This is a tremendous city. We're very blessed to have so many assets, and Royal Pavilion and Museums sort of Trust is part of that. So over the course of the last 6 months, we have prioritised many arts organisations for grants as part of our lockdown support funds. We've helped organisations through many difficult situations by prioritising the arts and culture and creative organisations through the money that we've had from government. We're one of the only councils in England to have really prioritised the sectors through lockdown grants. And we've managed to support resilience and hopefully recovery through distributing over £1 million through the grants process in a couple of months over the summer. Our next job as a city council is really to create an environment for the arts and for creativity and exchange to flourish in the city over the course of 2021. And this is very core to our thinking at the moment. So we really welcome input to that and are very appreciative of everyone's input today, and we'll be considering that very carefully in the months to come. Thank you.
Donna, thank you so much. It was great to get that whistle-stop tour of all the work that you're currently doing. Thank you for that. I'm very aware of time. We want to allow some time to answer questions, and I hope that the panelists will be able to just stay with us for a little bit longer than planned. So last, but by no means least, we're going to go to Josh Cullimore. Josh is a GP and also clinical lead for urgent care at Brighton and Hove Brighton and Hove CCG. The clinical commissioning groups are the NHS's organisations that are responsible for delivery of NHS services. But Josh is also passionate about the arts, particularly visual arts and literature. He has written a screenplay himself and is also really, really passionate about the impact that arts and culture can have on health and well-being. Josh, you're very welcome.
Thanks very much, Jane. Yeah, I'll keep things short. As a GP, we're quite good at keeping things brief. I'm a GP, but it's taken me quite a long time. I've come through various routes. I did mental health training. I did public health for a couple of years, and I've been really involved in community theatre, like you say, some writing, and with patients, I've seen the benefits of the arts. So it's fantastic to hear about all of these organisations, and yeah, the rise of social prescribing is making a big impact as well. And it couldn't come at a better time with this pandemic, because as our other contributors have said, we are in a mental health crisis. I've never actually seen anything like it in my clinical work. You know, with the suffering that people are going through, and it's difficult dealing with the requests for benzodiazepines, opioids, like you say, Jane. And we only have to look at the opioid epidemic in America to see that, you know, a warning of what could be awaiting us if we're not careful. So I think it's really vital that this work is happening for both mental and physical health, because there's a lot of overlap. You know, dealing with chronic pain, lots of different physical conditions really benefit from any activity that helps people get into a flow state, that helps their creativity. My time in mental health, I was really impressed by the work the occupational therapists did, say on the dementia wards, getting people involved in listening to and producing their own music. You really see the happiness that produced was far greater than any of the medication we were giving them. So yeah, fantastic to hear about Bella's work with Silver Strings as well. So I will definitely be recommending that to people. So I would just say, you know, please do let us know, that the CCG and GPs directly, about the work you're involved in. Part of the challenge is knowing what is out there. It's great we've got social prescribing now, but we do have a bulletin that we send out from the CCG to practices with information and news. So I'll put the email address in the chat, and you can just let us know, and we can spread the word, because we don't want this work to go unnoticed or to be underutilized. So yeah, I'll leave it there, but thank you very much, everyone.
Josh, thank you so much for that. It's really interesting to hear your perspective on your work. So I'd like to invite David to come back in now. David Brindley, I hope you're still there and still with us.
Yes.
Hi, David. Hello. Hello. I hope everyone's okay to wait for another 10 minutes or so to respond to these questions. So, David, I'm going to hand over to you just to put those questions to the panel. Thanks.
Yeah, we'll do. And just what a fantastic sort of range of perspectives, really. You know, fascinating. And just to quickly say, as Josh highlighted at the end there, that challenge for health and social care professionals of what is actually out there, because there is so much. And that's where we're lucky, really, as a city. We have so much going on. This is a question for the panel, and we can go around one at a time. We had two questions, but I think just to save a bit of time, I'm going to combine them both. So it's all about this. This is all about us being recognised as a centre for excellence for arts and health work. That's our ambition, really. So, what, in your view, and from your own perspective and from your organisation, needs to happen to realise this, and for us to go to the next level, and just added on to the end of that, and this is probably more relevant for Donna, James, and possibly Josh. You know, there's going to be an anticipated increase in demand for those working in arts and health services, particularly practitioners, in the light of COVID and supporting people's mental well-being. So where will the resources come from to meet this demand? So we can fund social prescribing link workers, but who's going to fund the work that they then signpost to? So it's about how do we achieve our ambition to be a centre of excellence, and where can we get the money to support ongoing work? So if you don't mind, I'm going to do this slightly differently. So let's start with Donna.
Yeah, I've been thinking about this actually, and I think in many ways you touch on the fact that, I mean, Brighton and Hove is already to some extent a centre of excellence, and I think building on that, events such as this build on that almost immediately. And the energy and the commitment in the city, the way that it's evident through this event, is part of that kind of pushing our agenda further and further. I think also a further combination of applied research into pertinent topics, and the combination of the University of Brighton and the University of Sussex with all of the practitioners and organisations here can really come up with some incisive and innovative thinking that's useful and quite, I suppose, again, applied at a UK level. So for me, it's about the combination of practice with research, innovation and ongoing excellence that really moves the whole agenda on. In terms of the second part of the question, I think we are all obliged to, first of all, use existing resources much better. I think we need to align, we need to be focused, and we need to identify a combined set of priorities and make sure that we're not all in silos, first of all. Because while we're all different and coming at the topics slightly differently, we all have a combined and shared ambition, and I'm not sure that that's always expressed and understood as well as it could be in terms of the resources that we have. I think the second thing for me would be about thinking laterally. I mean, in terms of maximising funding opportunities, external funding opportunities at UK government level, across the arts, sports, communities and health, so that we're not just thinking about arts and well-being or arts and health, we're actually thinking about the way in which our agenda improves health, it improves sport, it improves a number of other topics, and we're working collaboratively across all of these to ensure that we're maximising the funding opportunities that are out there and bringing them to bear on the topics that we feel are most important to us.
Great. Thank you, Donna. I'm going to move straight on to James. James, same question for you. So how could Brighton and Hove be a centre of excellence, and I suppose particularly relevant with social prescribing? Where will the resource come from to to fund practitioners as well as social prescribing link workers?
Thanks, David. I'm going to start by just agreeing fiercely with what Donna's just outlined, actually. I think it is about collaborations and actually really brave, bold new collaborations. I recognise that there are too many silos, whether that's between statutory bodies supporting health and social care, or whether that's at a local community voluntary sector level as well. I think we do have a common language. I think we do share that common purpose. We don't always use it. We don't always use the tools that we've got to link it up. And I think one of the things that we need to do very, very quickly, if we are going to support society to recover and to achieve its best, is that we need to put some of those fairly petty arguments aside. I don't really care whether it's called social prescribing or local area coordination or community development or, a whole plethora of terms that refers to what we're talking about here. The reality is we need statutory bodies to do the work that they do very well, and we need voluntary community sector organisations and arts and culture organisations to do their work, and we need to bring it all together in a much more coherent way. And I think, I personally think the social prescribing movement enables us to do that. It doesn't look at it from a hierarchical perspective. It looks at it on an equal perspective, that everybody's got a very strong contribution to offer. In terms of the specifics in relation to money, whilst I'm not saying that there is enough money out there, we could always have more money invested into the arts and culture sector, but also sports and leisure and natural environment. That will always be very, very good. I think that combining efforts is something that we need to see more. My challenge would be to arts and culture based organisations in Brighton: are you already linked to the sports and leisure and natural environment and information and guidance organisations? Because I think part of the future is creating really, really innovative collaborations that can work across what we call the 4 zones of social prescribing, to create packages of support for individuals that health and social care bodies can commission a lot easier. Because I think sometimes there's a lot of competitiveness that just gets in the way. Separately though, the Thriving Communities Fund that we launched alongside the Arts Council, which is a £1.4 million grant, which is just a starting point. This is through the National Academy for Social Prescribing. We want to attract more funding into that programme so that we can have local shared investment funds that are easier for arts and culture organisations to access. So that's part of our big plan if you want to engage with the work that we're doing through NATS.
I'm going to go to Polly next. Polly, if you're there. And I'm also going to tweak the question slightly because we've had a question in the chat box, which is from Nick Ashwell. So, Polly, the question is still there about being a centre of excellence, but Nick has asked, how can a centre of excellence make itself safely accessible to a culturally diverse group of young people not usually engaged in the arts? With the growing numbers of disaffected, unemployed 16 to 24-year-olds and increased vulnerability of school-aged children, I'm just thinking that might be particularly relevant for your organisation and the work you've done that you described with teenage girls. So how can we combine the two, really, being a centre of excellence and still engage with, you know, the most difficult people?
Well, I think there's something about just going out into the communities and starting those conversations, and it's about creating the conditions, the core conditions in the communities in which these vulnerable young people are living, in where they're going to school, where they're going to, where they're gathering, and how can we kind of help to develop training and expertise and conversations in all areas of their lives, so that there's a sort of fertile ground in the grassroots. It's sort of coming up from there, and it's slow, it's not quick, and it's also, it would be awful to think that any of us actually had the answers, because it's a huge problem and a huge crisis, and you know, huge depth of difficult feelings and problems that are out there. So it's really just about beginning to come alongside and connect and relate and play and educate and train.
Okay, brilliant. Thank you, Polly. I'm going to move to Josh. So kind of the same question, Josh, but I'm thinking as a GP and a representative of the CCG, the title of this conference is particularly relevant. So more culture, less medicine. So how can, and Emma has put a question here, how can GPs and CCGs ensure fair and equitable access to arts for wellbeing resources? And I suppose that relates to the money question about how can, you know, the CCG support this work financially and move away from always going with these kind of clinical models of health, you know.
No, that's great, and I completely agree. And I think there has been a complete recognition of that, and that's why the social prescribing has really taken off. I think it's also just a cultural shift amongst GPs when we've got very short appointments, and you have people in a lot of distress wanting a easy, quick solution, which giving a medication seems to be. But I think it's sort of stepping back and getting the GP getting the CCG to, you know, show leadership in this. And me and my colleagues, clinical leads, are definitely pushing this. But to actually step back, and if someone is presenting with chest pain and shortness of breath, not only thinking of the physical causes, but, you know, is this a panic attack? We're seeing a lot of that this year. And what is the answer for that? Is it benzodiazepine, or is it referring to social prescribing, one of the many groups that we've got in Brighton? And that's what I was saying. It's, you don't want to feel like patients are being fobbed off and being told, no, you can't have that, just go and do some painting. You want to be able to give people some specifics, some actual tangible support. If you can give people the details of organisations, that feels like you're actually knowledgeable and addressing their particular needs, and it's because you want to help them rather than you're just being a mean doctor. So yeah, I think it is just reminding ourselves. I think most GPs are aware of this, but we're as stressed as everyone else at the moment, reminding ourselves, each other, that medicine is not always the answer. And in this pandemic, we're seeing a lot of things which shouldn't be treated by medicine primarily. And it's linking services, like everyone's saying. We need to be aware of what's out there, because we, as GPs, we have a great privilege of having contact with people. They come to us often as the first port of call, so it's a real travesty if that opportunity gets wasted.
I've been in public health in Brighton and Hove since 2006, and I think the landscape in primary care has really changed over those 14 years, and we are now sort of pushing at an open door. So I think, you know, we just need to keep sort of working with our GP colleagues and CCG colleagues, and you know, and we'll get there. I'm going to move on lastly to Aristea. So Aristea, from the University of Brighton, and from with your sort of research hat on, you know, how can you support us to be a centre of excellence? We won't look to the university necessarily to provide the funding, but of course you are in a position to pull down money sometimes.
Absolutely, yes. Thanks, David. I think the university has a particular role to play in this. What we are trying to do is to forge these collaborations and to bring research a bit closer to the communities. I think the universities and research projects in particular have the capacity to do this with, you know, we have the funds to organize symposia. We have, you know, events like this to bring people together and bring industry partners and communities and artists together. I think collaborations, forging collaborations is a key for this. Of course, funding is available to us from research councils, and from my part, for the next phase of the project, I am aiming to direct most of this funding to develop and to support these collaborations between community organizations and artists, where we are funding for, we are, you know, seeking further funding and to work with HERA, with Wellsborn, with Together Co, with Citizens Online, with a number of organizations, and to make sure that we actually can reach people from who are like doubly marginalized, and this has particularly been evident during COVID, where we saw that we had a crisis, a health crisis that was at the same time an information crisis and a communication crisis for those who couldn't have access to information, and there was lots of misinformation going on online as well. So it is important, I think, to bring these aspects together, and I think that we are in a good position in Brighton and Hove because of the two universities, and because of our, you already work with Duncan and our Centre for Arts and Wellbeing. We have lots of interest and lots of capacity within the information, within the institution of both artists and practitioners who work within the university, either part-time or full-time, and who are really committed to supporting arts and well-being.
Brilliant. Thank you. Thanks to all the panelists. Thank you, everyone.
Thank you.
I think, Jane, we're going to move swiftly on.
I think we are going to. I just wanted quickly. I sort of pulled out some key things from that conversation as I was listening to it, and I just was going to run through them quickly on. But the things that came through for me was about not being in silos, about brave, bold, new collaborations, about having a common purpose, about looking at our Thriving Communities programme and really looking how we can think around other shared investment into that fund, about focusing on in terms of young people, particularly those 16 to 24-year-olds that are going to be impacted so much by COVID, really looking at the conditions in which those young people gather and ensuring that they're supported in all areas of their lives. It's about leadership from the CCG in terms of having the capacity to give tangible support to people outside of prescribing drugs. It's about acknowledging that medicine is not always the answer, and also that universities have a role to play, that they are, as Aristea said, they're bringing research closer to the community. And also it's about universities collaborating with key organisations who are delivering outstanding arts, health and wellbeing opportunities to our local communities. So those were the things that really popped out for me, and I just wanted to sort of run through those and acknowledge everyone's contribution.